Hello, and welcome to the second webinar in a series for the Youth-Led Ohio Adult Allies Initiative. This webinar covers using the OES website to access data and using the local data access forum from the Ohio Adult Allies website. I will be your host for this webinar. I am April Schweinhart from the Pacific Institute for Research and Evaluation, a nonprofit firm which partners with Ohio's university's Voinovich School for Leadership and Public Affairs on multiple initiatives aimed at decreasing problem substance misuse across the state of Ohio. This webinar follows a first webinar in this series focused on defining and determining a problem of practice. Today we will focus on working effectively with youth, using and accessing the OES website, and interpreting data. If you've watched the previous webinar in this series, you're familiar with using a data-driven, outcomes-based process. To review, the reason we use data-driven, outcomes-based approach is that we are tackling large, difficult problems. When you're working on an issue that affects the entire state or the entire nation, it can seem like change at the local level isn't enough. But in using an outcomes-based approach, we can show how small steps lead to big change. Quantitative data that can be measured over time is needed to show that the strategy we choose to implement matters. When youth use measurable outcomes, they can see how the strategies they're implementing are making changes in the community. This supports their interest and excitement for the work and the issues. Something we also cover in the first webinar is the type of data needed to determine a problem of practice and measure change over the time. These data are quantitative consumption data that are measurable over time and specific to a population and a substance. Quantitative means measurable. Consumption data are those things that tell us how much people are engaging in substance use behaviors. Measurable over time means that the same data can be collected again and again. The population of interest represents the entire collection of individuals that you're targeting. For example, all 12 to 15-year-olds. Accessing the right kind of data may feel intimidating or tedious. This is why it's important to break it down into actionable steps. Working with youth means it's important to put things into context and to break down logic behind why we do what we do. We want to make sure that our words aren't getting in the way of doing good work. To support youth to understand the importance of data, it's helpful to understand that tackling big problems starts with small steps that are specific to your local conditions, the people most affected in your community, and specific substances or behaviors. Data about these specifics will drive decisions about your goals based on your community's needs. It's also important to understand that without specific data from your community, it's difficult to determine the best way to address big problems related to substance use, or behaviors, or life experiences. Lastly, it's also important to see if strategies are working. And to do this, data must be measured before and after implementation to be compared. Young people will be curious about data, so it's important to be prepared for questions. One good source of data accessible to all in Ohio is the OES website. More on this website is available in another webinar called Making Data Work for You, Utilizing the OES. The OES is a survey that asks about youth substance use and related behaviors for grades 7 through 12. The website offers access to data reports from entire OES sample, so everyone who took the survey, or everyone who took the survey in specific counties or specific Adams boards. And these reports include data summaries on responses to the OES. These are exactly the kind of data that can help inform your strategic plan. To get started, click on the Results tab on the OES homepage, as you see here. The Ohio Healthy Youth Environment Survey, OYES, provides important survey results about the health and safety of adolescents across Ohio. Information can be useful for many groups, including parents, schools, parent-teacher organizations, policymakers, public health officials, prevention coordinators, health and human service agencies, community coalitions and health and safety networks, and basically anyone interested in youth and youth-led programs. The OES includes information on the following topics: demographics, alcohol, tobacco and vapor products, marijuana, prescription drug misuse, illicit drug use, bullying, safety and violence, physical health and well-being, mental health and suicide, school climate and safety, gambling, family and peer factors, school success, community environment, and sex-related questions which are optional in some areas. Scrolling all the way to the bottom of this page will allow you to see the data that are available. There are publicly available reports. The raw database and COBIC are available if you are already data savvy. But for this webinar, we will be utilizing the reports that the OES team has already put together for us. This page is also accessible by highlighting the Results tab at the top of the homepage, highlighting Public Access Reports, and clicking the Reports of Interest. As you can see, these reports are available at the county level, board level, and regional level. Let's click All Reports tab to see the report that combines data from all schools who have agreed to implement the OES in a given year. The OES has been completed every school year since 2015-2016. This website provides an all OES report as a summary of all of the Ohio students who participated in the OES each year. Because the OES is not mandatory for Ohio school districts, there are some limitations that must be kept in mind. The OES data were collected based on a descriptive cross-sectional survey design with a non-probability sampling method. The voluntary nature of the survey means that the OES results are not generalizable to all Ohio youth. This report for the entire OES sample from the most recent year of data has a lot of information. It can be helpful to review the appendix to find out what is of interest to you. Be sure to read the introductory sections shown here to clarify the data collection procedures, limitations, how it was administered, and the participants. Young people will want to know all of the information about how the data were collected and who was in the sample. Being able to answer these questions will give your data a leg up from the beginning. This all OES data may not be useful to you when planning for a strategy to affect change at the local level. You want something that represents youth in your local area. If we go back to the reports page, we can pick something more specific, such as county level data. Find your county's reports, but this can be tricky as not all counties participated in all available data collection years. You may have to look at the board level or region level reports for your area. Even within a county or region, not all of the schools who were eligible to participate may be included. Be sure to keep this in mind. Once you have a report of the data relevant to you, review the local data access form available on the Ohio Adult Allies website to see how the report pulled from the OES website can be useful. We have developed this form to walk you through the process of looking for relevant data to help guide your decisions. When youth are presented with this data, it will help them make decisions about what problem to address and which strategies make the most sense to implement. To get started, the report you pull from the OES website should tell you the schools in your county or area that participated in the survey. You can tell which years you have data for by searching for your county or region on the county, board, and region level data pages. For example, Williams County has data from 2015, 16, and 17, but not 2018. Pulling the data relevant to your area will prepare the youth you are working with to start to read the data tables and find the data most relevant to the problems and goals that they are thinking about working on. Note that there are often many survey items on the OES that may be relevant to include in your problem statement on your strategic plan. For example, bullying-related questions include, among those who have experienced bullying in the past 12 months, during the past 12 months, have you ever been bullied on school property? Have you ever been electronically bullied? And what types of bullying have you experienced in the past 12 months? Be sure that you consider the comprehensive range of items that may be relevant to your youth's identified goal or problem and how each might contribute. Using multiple data sources is a great idea, and it can help narrow your focus and specify your goals further. When looking at these questions, also keep in mind that everything we just mentioned is part of a STEM that asks whether or not students have been bullied in the past 12 months. So these questions only include those who have been bullied in the past 12 months. The key to knowing this is that the questions begin with among those who have experienced bullying in the past 12 months. There are many questions like this on the OYES, and it's important to identify the stems like we've done here so we know how questions relate to each other. Here we can see an example table of data reporting youth behavior related to riding in a car with a drunk driver. The table shows the overall results for OYES participants in this year, as well as the number for this specific board region. The table also shows the number of responses for each response option for this question, as well as that number translated into a percentage of people who took the survey and answered this question. This is why the percentages add to 100 at the bottom. The data from the OYES can be extremely helpful because some counties or areas have the same data available over time so you can see trends and behaviors. For example, here is data on parental perceptions of prescription drugs from Wyandotte County Board from 2015, 2016, and 2017. If we look at the percentage of youth who responded not at all wrong, the first response category, we can see that the percent has steadily decreased from 2015 to 2017, from 3.36% to 1.40%. This is a great way to show, for example, if Wyandotte County has implemented a strategy to address prescription drug misuse, that this strategy is working, especially when we consider the percentages for the entire state. If we go back, we can see that these percentages are 2.42, 2.37, and 2.45. So this percentage mostly stayed the same at the state level. Note as well that we looked at percentages of responses instead of raw numbers because a different number of youth took the survey across the 3 years. This kind of comparison is something you will have to pull for yourself from the 3 yearly reports if you are interested. The OYES provides fairly comprehensive substance use data from youth in Ohio, but as noted, there are several limitations. If you cannot find relevant data to your specific county, look at the Behavioral Health Board data. If you still can't find data relevant to your specific area, it's okay to use the entire All OYES report or data from the CDC or Ohio Department of Health. The All OYES data may be useful as a comparison data to begin, but you'll also want something that represents youth in your local area. There are certainly other sources of data that can be helpful for a planning process like ours. You may even want to collect your own data. Know that starting with higher level data and making a plan to collect more local level data is better than not using data at all. Moving forward is better than remaining frozen in place. If you are using data from another source for some reason, be sure to take note of the same measures we have for the OYES. Outcomes, survey item and response options, population sampled, total number of people served, total number of people who answered this question, and any other relevant variables. Some sources of data may have more consequence data, while for our purposes, we need outcome data, what consumption of substances is like. What if you can't find data on any of the potential issues your youth-led program are interested in? As mentioned on the previous slide, you can level up to a region or state level of data that is still relevant to your problem of practice to start. If there's still no data available, even at a higher level, this becomes your problem of practice: how to find data relevant to the issue at hand and meet your goals. Youth advocacy can be the goal for the first year of your youth-led program. Since collecting data is now your problem of practice, focus on using the youth voice to engage schools, religious organizations, and health systems in joining your cause. Young people can be the perfect voice to get schools on board to complete the OES, and showing that you have no data at the local level can be the perfect reason to join this effort. If your funder or grant requires that you have outcomes-related data, you want to use the most local data available, but in some cases that may mean only state or national data is available, even if it's not specific to your community. Collecting data on your own problem specific to your community is an option. If you find that you are missing data, consider working with school districts to use the OYES. There are some large considerations and limitations to collecting your own data. You can't compare to state or other counties if you're asking different questions. It's difficult to get schools on board and ensure data security. And collecting data from minors has risks. They can't consent, and you must get parental consent. Parents and community organizations can help support the youth voice by becoming OES champions. Being a champion shows youth that there are many adults that care about them and the issues that affect their lives. You can advocate for the schools in your communities to participate in the OES by contacting your superintendent or principal, whose contact information you can find on the Ohio Department of Education's website, linked on the OES website. Your district superintendent or administrator will be asked to register their schools to participate. You can encourage youth groups and organizations in your community to request the school's participation. Contacting the Prevention Action Alliance for more information about the Ohio Youth-Led Prevention Network and information on community coalitions can also be helpful. You can talk with your local parent-teacher organization about the benefits of OES, and there's a link here on the OES website to download the Frequently Asked Questions document. You can share how the OES results will benefit your organization or community. Training is available on how to access and use the OES results and on existing available data through the Ohio Network of Care, which is available online. There's also help at info@oes.ohio.gov, and you can look for dates on the Ohio MOS calendar regarding when the OES is administered. If we have local data, we are ready to ensure that our problem of practice is supported with data. After reviewing and using data, you can specify and determine a problem of practice. We reviewed problems of practice in another webinar, so here we are focusing on the data component. Under the problem statement, you should include the data supporting the problem. When going through this process, be sure to include the substance, the target population, relevant results, and tie it back to how you know the problem statement is true. For example, if our problem statement is that youth in our community are increasing rates of vaping, the data to support our problem statement should show an increase in vaping over time for a specific age range that includes youth. Also be sure to include the source of the data. For example, the OES 2017 survey results for Adams County. This way you'll know where to look for the same measure again when you need it. Remember that reviewing and using data helps support your problem of practice. You should not be looking for data once you already have a problem you want to work on. The data underlying the problem of practice then links through the intervening variables and evidence-based strategy selection to the outcomes we expect to change through our efforts. The same data source or type should be used at the end of your planning process to measure change. This is why it was so important that our data be measurable over time. We want to be able to access the same or similar data in the future after our intervention is complete to be able to show the long-term change that resulted from our efforts. That's why we reminded you on the previous slide to include the source and other specifics about the data to support your problem statement. When you go back after implementing your intervention, you can find the same source for the same substance among the same people and show change in the quantitative measure. For the OES, there should be new reports updated yearly. Other data sources are updated at different times, so it's important to look for data that is collected frequently. Technical assistance accessing and using data from the OES website is available online or by phone, and the Adult Allies website is a good source for more information on strategic planning. Thank you for watching this webinar on making data work for you, utilizing the Local Data Access Forum and the OES website. For more about the OES website and using the data warehouse there, check out the final webinar in this series, Utilizing the OES.